Welcome to the Relationships Inside Out podcast with Doctors Gregory Siebert and Kimberly Murray, licensed marriage and family therapists. Join them on this journey as they explore the ins and outs of relationships.
Welcome to Relationships Inside Out, where we have a special guest today, Dr. Tony Marchand, who's a chiropractor at New Beginnings Chiropractic. Most of you are probably wondering, well, how does this make sense? Bringing a chiropractor on a podcast about relationships with ourselves and others. And that's very much what we're going to be talking about today, is the important intersection between physical and mental health. And so we'll allow Dr. Tony to introduce yourself and get this going.
Hi, guys. Thanks for having me today. So I'm Dr. Tony. I'm a chiropractor here in Windsor, Colorado at New Beginnings Chiropractic. I also have a degree in public health. I graduated from Syracuse in 2016, and then I graduated from Palmer College of Chiropractic in February of 2022. So I am pretty fresh and new to the working world.
What brought you to chiropractic care?
So when I first started my chiropractic endeavors, I knew nothing about chiropractic care. I took 2 years off from school after I got my bachelor's degree in public health. I was still really unsure of what avenue I wanted to take that degree. I just didn't fit into the medical world necessarily. I felt like health should be addressed in such a different way. So I applied for a position at a chiropractic office and I started working there for 2 years. I was doing a lot of, like answering phone calls, scheduling patients, but I was working very closely with the docs. And one day I just said to the doc, I want to do exactly what you do. So I did. And that's how I kind of fell into the chiropractic profession. If you would have asked me even 10 years ago if that's what I would be doing, I would have said, probably not. So I feel like chiropractic more so found me than I found it.
I love that.
Yeah, that's great. And for some of us who have never been to a chiropractor, do you mind sharing a little bit about that experience and what that's like from your work?
Mm-hmm.
Yeah, so chiropractic care, I'll just kind of give a really brief general statement about what it is. So I use my hands you can use the word manipulate, adjust different parts of the body. And what I'm doing is I'm looking for lack of movement in the body, lack of range of motion, and I restore motion into those areas that are restricted. That would be the gist if you were to probably ask somebody that's received chiropractic care what I do. Mm-hmm. But I additionally kind of like to look at everybody as whole body. So when I approach care, I kind of approach it by what I would call the biopsychosocial model. So when I first meet a new patient and I'm doing a thorough history, and I start asking them more questions like, how is your sleep? How is your stress? What is your diet and exercise like? Some people understand that avenue and why I'm asking, and some people have no idea. And that's where the biopsychosocial aspect comes into play. Bio meaning mechanical. So you could have some physical distress. You could have tissue damage. Things like that. Whereas the psychological component, I'm looking at your trauma. I'm looking at how your coping skills are, your stress, things like that in your life. And then the social aspect, your support system. Do you have one? Do you have family that you go home to? Do you go home and you isolate? I'm looking at your socioeconomic status or your availability to other parts of the healthcare world. So healthcare or health in general for somebody is not just your physical symptoms. It's all three of those components. And sometimes you might not feel stress. I mean, you do, but you may not think, well, I'm not stressed. But until you truly look at those aspects of your body and yourself, you might not realize the connection until you start diving into that. So that's why I like to bring those questions up to patients so that they can kind of make that connection of, when I have days of higher stress, I might have days of higher pain.
Mm-hmm. I love that. When I talk to clients of mine and they come in talking about pain, I talk about it as like a cycle, right? Pain makes us grumpier, but our grumpiness also increases our pain. Mm-hmm. And so
Absolutely.
I love that you blend those two spaces together, right? And then how I experience my pain, whether it's psychological or physical, might then impact how I parent, how I connect with my partner or don't connect with my partner, how I am in my profession. And it's this wholly integrated space.
Yeah, a lot of us providers get stuck on our profession, and that's our tunnel vision. And I was trained also in the biopsychosocial model, right? That mental health isn't just a psychological phenomenon. Sometimes it's physiological, and end up being, example, thyroid, right? Hypo or hyper. So I love that you kind of approach it from that model. I mean, how many patients do you have come in and they are even aware that mental health is even a component of your work?
Not many, which is sad, but I do have some that are like, I know that I'm stressed right now. And that's the first thing that comes out of their mouth when they come into the room to see me. And I'm so proud. I'm not excited that they have stress, but I'm so proud that they acknowledge, like, I'm really stressed today. And that's why I know my pain's on a 7 rather than a 2.
We know is when we're stressed, right? Our body is preparing for the run, is preparing to run from the bear. It is tense. We get tight. We aren't loose and fluid. Or what about other parts too? When people come in with like anxiety, depression, things along that realm, sometimes they all get group distress, but do you see a difference there?
Yeah. So I even feel like physiologically, for a lot of patients that experience more so anxiety, when I touch their body, there's such a difference compared to somebody that you wouldn't quote unquote say has anxiety. They're so much tighter, so much stiffer. They almost retract their body into themselves as I'm just slowly palpating up and down the spine. There truly is such a physiological difference in those that experience high intense anxiety compared to somebody that manages that really well.
And kind of to Kim's point earlier, do you mind sharing a little bit about that relationship between how chiropractic care can help with anxiety or depression or some of those symptoms? Because you guys are hitting on a lot of good points in terms of the symptoms of anxiety, the tension, the headaches, right?
Yeah, absolutely.
You might kind of elaborate on that.
Yeah, I like to explain to a lot of patients, when I adjust, we're working with the nervous system and we're down regulating your body. So Kim, kind of like what you said, if you're living in that sympathetic state, like fight or flight, running from the bear, you need some type of down regulation. Like we need to get you into that parasympathetic rest and digest. And that's what I'm doing when I adjust you. The nervous system, it's more so those parasympathetic hormones. It's releasing more of the serotonin, not the cortisol levels that are up here. So when you're in that sympathetic state, you're releasing so much cortisol. My goal is to reduce that cortisol and replace it more with those like hormones that are helping you calm the rest and digest parasympathetic state. It's okay to be in sympathetic state, but to be sympathetic dominant is you're just living in that high quarter. Your adrenals are so fatigued. You shouldn't always be prepared to fight a bear. Like it's good to be ready for that bear, but you shouldn't always be running in that. You should be predominantly like rest, digest, like pretty calm. So for somebody that's completely living in that I'm running from a bear or I'm just ready to fight type of mode, I would honestly want to see them a little bit more because they need those happy hormones that the body releases neurologically from an adjustment. So for those patients that are high stress, high anxiety, I do suggest seeing them more often than I would somebody else. And when it comes to headaches, things like that, that's also I see such a reduction in those headaches when they come in more often because it's just another way of managing. It's another way of managing their stress because sometimes you need those additional things besides, even if they are doing mental health help, they are exercising, things like that. Sometimes people just need those additional adjustments to down regulate their body.
Yeah. And for those of you listening, the nervous system is made up of both the sympathetic and the parasympathetic. Sympathetic, as she was talking about, is what's activated. That's fight or flight or freeze. The parasympathetic, I look at it like the para is a parachute bringing down. That's the part of the system that brings it down. Give an example. So, yeah. And what's interesting too is I work with a lot of clients who've been in car accidents. And we'll get to a point where they've learned all the skills and stuff, but it isn't until they get those adjustments. It isn't until they can reduce the physical tension that they can start seeing movement on the other side. It's almost like sometimes it's a barrier for my work.
It definitely goes hand in hand, right? So if we have clients that come in, and I'm sure the same on your end, right? Clients come in and they're dealing with physical symptoms. There's only so much therapy can treat. And dually, there's only so much chiropractic care can treat. And so having this like team or holistic approach can be.
What do you mean? I'm going to talk your pain away. You're going to talk the pain away. You don't feel it anymore. You're amazing.
Oh gosh, I wish.
Yeah.
Be the
It's
Messiah.
okay. Everyone thinks I'm going to fix them.
And this is why, myself collaborate with, professionals like yourself, because it is a team approach. It's the biopsychosocial approach, bringing in collaborators from different fields that can look with different perspective and lenses to help treat somebody holistically, as you mentioned earlier.
Absolutely. I like to say to some patients, I can adjust you all day. It's the bread and butter of what I do. I love it. But until you address those other aspects of your life, some things may absolutely not change. You may be in here every single day telling me the same thing.
Right. Because if we're just staying in that tense space, in terms of our mental space, how can the body loosen, right? It has to be this kind of collaborative approach.
Yeah, that bidirectionality of it, right? So we loosen so you can focus on your skills, and then you focus on your skills to help not become as tense and stay tense.
Ooh, it's tough work. Now, Tony, I know at New Beginnings, you also work with like families and children and
Absolutely.
postpartum parents. Can you talk a little bit more about like that family approach of chiropractic care and why that's important?
Yeah.
Absolutely. So I love seeing families, especially when you have the littles coming in with parents. It's a really good, it just shows kids like you can start this whole healthcare lifestyle at such a young age, and it instills a different mindset of health, I believe. So when kids see their parents, like this is how we treat health rather than, other avenues, I think that's so good. On the other hand, sometimes I'll have spouses come in, partners come in together, and it's great. It's cute. It's like a little datey, like a date they're going on. However, sometimes I have partners that speak for partners. And so when I'm asking partners, how's your body feeling today? And then somebody speaks up, it's like, okay, I listen, and then we do the whole thing and they leave. And then I see that partner spouse that didn't really say much a few days later, and they're like, yeah, this is what's hurting, or this is what's bothering me. So sometimes I see it on the other spectrum where it's the spouse is speaking for the other one. And it's really hard sometimes to navigate that is, what are you truly feeling? Especially when I have one telling me one thing, and then I see them the other day and they're telling me another thing. So navigating that is very hard and interesting in itself. Yeah, I don't know if you guys see any of that in your practices.
As you were talking about that, I was thinking, I was like, okay, you need Kim and I in there.
I was going to say, cue couples therapist.
Well, what's interesting about that, it speaks to a dynamic of why doesn't that person feel freely to talk about it, or why is the other person feel the need to speak for their partner as if they don't trust their partner to get everything out. Like there's different phenomenon going on, but it's so important. And I like that you actually pay attention and are aware of that and don't just take it at face value and understand this person might speak differently to that. Because we see that a lot in family therapy of everyone is talking about how the other one feels. I'm like, I just need to know how you feel.
When I think about kids, right? Having kids be able to advocate, because I know you guys work with children. We had our baby.
Absolutely.
So when I was pregnant with our last one, I was adjusted the day I went into labor. I'm pretty sure that chiropractor put me into labor, which I asked him to, by the way.
Yeah. I love that.
He adjusted my baby at 3 days old and then subsequently after. And I was grateful because it helped her kind of get her body worked out after she had her own rough journey of birth, right? But also like if she was constipated, if she had colic, was cranky, I know chiropractic care can help with that too. So can you speak to how it serves the whole family across the lifespan?
Absolutely. So when you have a cranky baby, you're going to have cranky parents. So treating it's a lot of what I see. And I always ask parents when they bring their kids in that are having certain issues, I always say, well, how are you doing? Because it's not just, I'm not a parent, but I do know that parents will do anything for their children, and it hurts them when their children hurt and they want answers and they want to help them. So of course they're hurting as well as their parents. So I always ask them, well, how are you doing with this? So if we can help baby sleep, parents sleep, if we can decrease what's going on with baby or children, the whole dynamic is going to shift drastically. And sometimes it's getting parents will come in because they see kids as their priority. Kids come in first. So some of the parents, I don't even see, they're not on my schedule. They're just bringing their kids in. And eventually though, once child is better, parents will get care themselves. But it's very interesting when families come in. So most of the times they're bringing kids in first because that's their priority. But once the dynamic does shift, kind of like I said, child's feeling better, parents are like, I need this too. And then you see even more of a shift in the whole family because everyone's feeling so good. So sometimes it really starts with kids because parents are like, I have to take care of them first. And then you see this whole massive shift throughout the family. And that's one of the reasons I love what I do.
I love that. And what we know is if I'm stressed as a parent, baby soaks that up. Right. And so then baby becomes stressed, and children feed directly off of our emotions and vice versa. And so if we can interrupt that cycle, wherever that starts, I imagine that's pretty profound.
Down regulating family stress via chiropractic care. I love it. And what's different about kind of what you're talking about from what our work here as marriage family therapists is they'll send the kid in as identified patient. And then when the kid gets better, they're like, great. All right. See ya. At least in your profession, the parents are like, oh, I want that too. Right.
Yes.
So true. But parents always say, fix my child. And then they don't want to invest in it themselves.
But I love that. Cause
like,
it's
I'm good though.
I love that because it's going to the idea that you're helping, regulate their system through chiropractic care, which can help the emotions and help the stress levels. And then that improves dynamics, right? So even if the family doesn't come in, the reason why, we're talking about this today is that interplay of if you can downregulate your physiological discomfort and get in a better emotional state, like you're putting yourself in a better position to interact with your family and friends and loved ones.
Yep.
Absolutely. I think my goal is to always help people balance their own bodies, and then you see the balance in kind of the rest of your life in general.
It can help even if, say, you're working out, right? And you have physical limitations. I imagine you can help loosen up some of those limitations. What we know is that when we exercise, we feel better, right? We get those happy hormones. So it impacts, or it can impact it so many different levels across the board.
Yeah. And Dr. Tony, you're the expert in this stuff. I was just reading up a little bit about how chiropractic care can also help reduce blood pressure, which, in those experiencing anxiety and depression, they're at higher risk for hypertension long-term, right? If you're, like you said earlier, in that sympathetic state for long periods of time.
Yeah. I also think that has a lot to do with, so you have the vasopressin, you have cortisol, and when you are stressed and you have those high levels, you usually have high blood pressure. So when you can control those hormones that are so high that are affecting your blood pressure, and through adjustments, you're lowering those hormone levels, and that's when you see the decrease in blood pressure. So I think it's definitely kind of relates to that whole biopsychosocial model again, where you have the high stress, high blood pressure, down regulating those hormones like cortisol, getting you more stable with your adrenals, which you're achieving through chiropractic care. And then you're seeing better results with your blood pressure.
It's not just about today's health. It's about health in the long term too, right? Which is what we hope to as a therapist as well, right? Creating relational health or individual health on the long term, not just for the immediate pain and gain. Sounds like that's the same for your practice as well.
Absolutely.
So one symptom that I think is, to me, one of the most important symptom, but also a health behavior, sleep, right? Sleep is so important in the context of anxiety, depression, stress. Can you tell us a little bit about the role of chiropractic care in sleep? Because I know it's very, very important.
Absolutely. So a lot of children that I see, and adults, but a lot of parents are bringing in their kids because they're not sleeping, or they're even having night terrors as well, bedwetting. So they have a few consistent symptoms that all kind of correlate to not sleeping. And of course, I'm evaluating the body, the spine. And again, it kind of goes back to that down regulation, but sometimes I have to inquire a little bit more about the emotional and stress aspect of even children when they're coming in and they're not sleeping, especially when they're having night terrors. And it's hard to go down that avenue with parents because they don't want to, it's hard to think that maybe your child's experiencing something internally that you can't see. Like when I start asking, like, are there any big changes in your household that, could be manifesting in their sleep, their stress? And sometimes it usually is like there's, maybe there's a separation, there's a new job, dad or mom's at work longer periods of time, and it's hard to make that connection. But once I can kind of bring those to life, it's like, okay, so maybe that's the stressor that's causing child to not sleep or having the night terrors, things like that. So I'll typically see those children a few times, like a little bit more than I would some other children, to help down regulate the body with the stress and anxiety they're having. But the main part of that is identifying what's causing that stressor, that we need to see them more often to help down regulate the body.
I love that.
Yeah, it's interesting too. It's not something like, again, this is why we want to talk about this, have this conversation. It's not something you'd think about. And I've even thought about of that being an avenue.
I'm thinking about my child now. She's a sleepwalker with nightmares. So I'm like, oh.
Is she stressed?
Oh, girl.
Why is she stressed?
I have no idea. No idea.
But let's go back to the context of sleep, because sleep is such, I mean, it's involved in anything and everything that we do. I mean, if I don't get sleep, we're cranky, and that crankiness leads to potential tension, and that tension exacerbates my mental state, and then mental state negatively impacts my sleep. Sleep is such an important part of recovering mentally and physically. What's interesting is that, I don't know, experiences, I got some clients who experience pain and they can't sleep because of the pain. You mind sharing a little bit about like kind of your work in helping kind of reduce the pain to improve sleep and what that looks like?
Yeah. So, and pain is such a rabbit hole to go down in itself. So a lot of people that have that pain through their sleep, some of it could be acute, like they did have some kind of injury and it's an acute process, and it takes some movement, it takes some adjustments, it takes some, stretching, PT, things like that. And the pain is so intense because it's so acute that it is keeping them up at night. But we do like a regimen of adjustments, movement, etc., and that helps. But we also have the person that's having chronic pain, and they're like, I have this pain all the time, I can't get any sleep, it's just this chronic cycle of pain, no sleep, pain, no sleep. So of course their body is just not functioning well at all. And then it kind of takes you down the rabbit hole of explaining what chronic pain is to patients. And sometimes they don't even know what that is. If you were to ask somebody, what is pain? What is chronic pain? It's hard to explain. But I always explain pain as that's your body's warning system. So pain is telling, it's our protection. It saves us. So when your pain is that high, but it's chronic, you need to kind of analyze, why have I had chronic pain for 5 years? But also kind of on the physiological side of it, when you have chronic pain, you're sensitized to that pain. So kind of like if you have a muscle pathway. So like if you practice something every day, you do that muscle movement really well, like tennis or something like that. If you do that every day, that muscle pathway is really good. Same with the pain pathway. If you have chronic pain every day, that pain pathway, super sensitive. So that's part of why you're having that pain every day, chronically, all the time, is that pathway is on fire. So, so it kind of comes back to that whole model of addressing why are you in this pain all day? And then it's baby steps. So if we can address why you're having this chronic pain, but then it's addressing the first part, but then getting you to sleep. So it's baby steps of each of those three, parts of the biopsychosocial model. So if we can address the pain, we can address the sleep. But it always goes back to that part of identifying why. And I think that is the hardest part of my job for humans in general. It's the why.
And some of the clients or patients in your realm, they have an idea what the pain is, but it may not be accurate, or they do. And I think one thing to keep in mind here is that there may not be a solution to completely get rid of pain. Maybe sometimes it's management, sometimes it's reduce it, but maybe there is getting rid of it. But more importantly, it's looking at the biopsychosocial approach. What can I do biologically, chiropractor, right? Psychologically, a therapist. What are some ways to treat myself? Because as you said, my body warning system is telling me something.
100%. And another way I like to look at it is, you can have pain and you might not have any type of tissue damage. You might not have any physiological malfunction. Biomechanically, structurally, you might be doing great, but you have this pain. And that's when I kind of would refer out and be like, you might need to talk to somebody else. Like you might be holding on to a trauma. Your body physically might be holding on to something that has nothing to do with your mechanical, physiological standpoint. It's something that you've experienced that your tissues are holding on to. And that's when I refer to someone like you guys, because that's not my wheelhouse, but it's identifying that there is something more going on than what I can do for you.
And I love that you brought that, because it's a perfect segue into what I was also curious about is, in even despite all the research there that talks about this intersection, the biopsychosocial kind of relationship and a lot of phenomena that we experience, pain, mental health crises, how much do, those in chiropractic care actually assess for mental health symptoms as part of their intake and even as their outtake, right?
So honestly, in school, we learn to look for red flags, but those are red flags. It's not like we're not necessarily taught that should be like number one top question. What is your emotional state? It wasn't till closer to the end of me graduating from school, being in the student clinic, working with my staff doctor, where we started diving into it more, and he started asking patients. It was like kind of like a screening of yellow flags, red flags, but it was really important questions about like, how do you perceive your pain? And like, how many times a day do you feel like your pain affects your mental state? Questions like that. And that wasn't even until I was closer to graduating. Wow. So I feel like for me in my career, I'm just like touching the surface of how can we have more like screenings, and how can we integrate this way more into chiropractic and it doesn't seem taboo? Because sometimes even when I do bring it up to patients, they're like, why would this matter at all? Like, I'm in pain. And I get that, because that's what my profession does. We take care of pain. But how often is our pain like related back to our emotional state? Sure. How many chiropractors are doing that? And I think it needs to be more of a movement. And I think it is, because maybe you guys can speak to this too, like the past few years, how much has changed in the world, that mental health is becoming more and more sought. Like it's just, it's super important. And so I think as chiropractors, we are physicians. So we need to look at the whole body, and the emotional state needs to be very at the top of what we're asking our patients. And kudos to those other practitioners that are doing that, but that's something that we all should be doing. And like I said, it's something that I just started dipping my toes into more as I came to graduation.
What we know too is, even in the research with men, for example, they manifest depression differently than women. Women is more that like, or it can be more that like weepy, sad, sorrowful. And for men, often it manifests in physical pain. And so I'll see people in my own life or with clients and say like, oh, I have this physical pain. And I'll say, like, I'll bring up, well, could it be possible depression's on board? No, I'm not depressed. Right. And it's the stigma against saying like, no, the mental health's not there. It's just something physical. So I love that you have this intersection of the two.
Yeah. And like you're talking about screenings, and I think all of our professions can do that well. Like my training back in 2012 was in integrated care, or collaborative care at the time. They call it integrated care. And surprisingly, and it was in family medicine. And family medicine, at the screenings, they would do the PHQ-9, the GAD-7, right? Depression, anxiety, very standard. And a lot of people didn't in the beginning of it, they didn't really understand why. But more importantly is these screenings help us understand if we need to refer out and get the possible resources to give this holistic approach. But even with that, there's still not a lot of hospitals and practitioners who even do this integrated care. So it's very much all of our healthcare fields together kind of needing to do a better job at screening. And I can even improve, especially assessing pain in my intakes.
Even with like pelvic floor dysfunction, right? We see that in postpartum women. And oftentimes it's not that there's actual dysfunction happening. It's that we had a traumatic birth, or birth in of itself is trauma to the body, right? It creates this mass physical event. And I love that even working with like pelvic floor PTs and things around here, that they are starting to assess for mental health, because sometimes it's not a physical abnormality within the pelvic floor. It's I'm holding tension from that birth. And I imagine the same is true when you're working with parents after birth, of dealing with pain. And some of it is this tension from this very real event that happened for my body, and my body doesn't know how to let it go.
Absolutely. So in the office I work at, we see so many moms, and some have the most beautiful birth, and I'm so thankful for that. And then I have some moms that come in and they've had the most horrible birth, and they will flat out say that. And so that takes so much to heal from. It really does, because you have to heal from what it was and almost grieve what you thought it would be, and things like they're just going through so many different stages. And then they get ready and they want to have baby number 2, 3, but they haven't healed. They'll say to me, like, I have not recovered from my first birth, and I don't know how to navigate that. And again, that's when I definitely refer out to other providers, because that's not my wheelhouse. But just giving that space for someone to say that to me, to say, like, I haven't healed yet from my first birth, that I am not ready to navigate the second birth, or for them to even say, like, I've had some women say, I need this part of the, like, this pain to go away before I birth this next baby, or things like that. And I'm so happy that women feel comfortable saying that to me in the office, but that's when they need additional resources, because it's kind of like what they're saying, they need to heal and they need that. And some women don't even realize that they have experience, like they're holding on to, you know, what the birth was or what they thought it would be. And they're navigating that, and just giving them a space to truly feel that and honor that. For me, that's one reason I love what I do, but that's definitely when I would refer out.
Even pain or tension with sex, right? After we have a baby.
Absolutely.
We don't think about how there can actually be a fear response, because if I had this traumatic birth, I don't want anything, 1, penetrating my body. 2, I don't want to risk getting pregnant again, because that was a shit show. Right. And so then I create all this tension within my pelvic floor and my lower back and my shoulders and my neck and all the things. And it creates this like multi-system malfunction, right? Where maybe we do need a therapist and chiropractic care and pelvic floor or whatever, not just pain meds and doctors saying you're just fine.
Well, that's the American way.
Oh, trust me. Tony, I wonder if you could talk about some of the myths of chiropractic care. Like, we get this a lot as therapists of like, you're a quack or a shrink. I
mean, I am a quack.
You are a quack.
That's right.
Yeah.
And I imagine you face your own stigmas in your field too.
Absolutely. So I get called a witch doctor all the time, but I'm like, I love that. Please call me. No, I'm just kidding. But yeah, we get called quacks, witch doctor, like, or they use the term like, this is so boo-boo. And I'm like, yeah, it is. Like, I'm crunchy. No? But yeah, so a lot of people like to say, oh, you're going to pop my back, you're going to pop my neck. I'm like, no, I'm not. But so a lot of people, when they come, they're like, you're going to fix my pain. It's all about the pain. It's all about that satisfying crack that we get. And it's such a stereotype, because sometimes I don't even need a pop and a crack. Like, I say that with quotations, from a patient to get the same exact results that I want. It's all about, so kind of getting to the physiological points of it. When I'm adjusting and getting like thrusting and you hear the pops and cracks, it's me getting to like the end range of a joint. And I don't necessarily need what we would call a cavitation, which you hear, you know, pops and cracks. I don't need that cavitation to get to the end range of the joint and give you the movement that you need. So it's so satisfying for a patient, and even myself as a doctor, when you hear that, you know, pop and crack, you're like, yeah, got it. And it's like that's when those like happy hormones are released for everyone in the room. But it really is a myth. Like I said, getting to that end range of a joint, you don't need pops and cracks. So that's definitely a myth. And I also think that just seeing me as a pain doctor these days is such a myth, because kind of what we're trying to address even in this podcast is, I'm not just a pain doctor. Like, I'm here to advocate for you. And I always say to patients, I'm one piece to your health puzzle. There is multiple, whether that's a therapist, a physical therapist, like even going to the dentist, that is another piece of your health puzzle. And I'm one part of that. but I'm not just your pain management doctor. I'm here to, I want to address your pain and get you out of pain so that we can start looking at those other avenues of your life. Again, like emotional, sleep, stress, diet, exercise. So if you can remove someone's pain, of course, it's easier for them to start navigating that. But it's also, I'm not just going to ask about your pain. And I hope that that myth can be a little bit more dissolved after today, is I'm not just your pain doctor trying to get your pops and cracks and fix you.
One other myth I think about, so I work with Dr. Tony, professional level, as well as she is my chiropractor, is it's not just like I hear chiropractors and people talk about like, oh, they're just going to pop my neck and back. It's also your feet, your sinuses, your cranium. Like it's a much more in-depth process. Can you share a little bit about that myth of how it's greater than just the spine?
Absolutely. So, the nervous system controls your body. And sometimes I refer to myself as a nervous system doctor. Like I am looking at whole body. So kind of like what you said, feet, sinuses, things like that. There could be dysfunction, not just in the spine. And that's why I'm looking, every time I see patients, I ask about their extremities. People use their hands all day, whether you don't realize that or not. Like you're cooking, you're at a desk with your job. I always ask people, how are your wrists doing? How are your elbows? Or I have people that come in sick. They have, they're like, oh, I've been so sick this week, congestion, things like that. I'm like, okay, let's do some release on your sinuses. I'm truly looking at whole body. And if you're not looking at whole body, what are you looking at? And I mean, no disrespect with that. Like chiropractors are doctors. And if you're not looking at whole body and how that's connected to people's symptoms, what are you looking at? So kind of like what you said, if people have feet problems, I'm going to look at ankles and hips. It's all connected. So and that's how my mind works. If there's one issue at one part of the body, it's 100% affecting another part of the body. So kind of along that statement, it's all connected.
I love that. Yeah. Tony, is there anything else that you want to share about chiropractic care that you think is important for listeners to know?
I think if I look at chiropractic care, the best thing I can say is what I do is I truly hope to bring balance to you and your body. And that is my goal, is to just bring balance to you. So that would be my overall statement about chiropractic, honestly.
I love that.
Yeah. And kind of really take away from this too, is that when we talk about mental health symptoms and our relationship with ourselves, it isn't just going to a therapist to deal with anxiety and depression. You can go to a chiropractor. You can go to other providers that might help with this bio, psycho, and sociological factors impacting your mental health. And this is such a very important topic, because this is not something we typically think about. Even as a healthcare provider, the ones trained in it don't think about this. So that's really the big takeaway here, is that intersection between the both physical and mental health.
Tony, I'm so grateful you joined us today.
Yes.
Being able to dispel the myths about chiropractic care, talk about collaborative care, right? We're not just saying you go to a chiropractor, then you go to a therapist, then. It's kind of in tandem, right? And so I'm really grateful you've opened up this dialogue about it.
Absolutely. I'm so thankful you guys gave me a platform to speak. And I hope that this is a great avenue for people to kind of start looking into pain and emotions and the intersection of that, and trying to navigate that for themselves.
Absolutely.
Well, this has been Relationships Inside Out. Today we had our guest speaker, Dr. Tony Marchand, who really helped open up my eyes. And I see her as a patient, but opened up my eyes to that intersection between physical, social, and emotional health. So we're deeply grateful you were here. We will have her contact information in the links below. If anyone has any questions, concerns, topic suggestions, as usual, please let us know via relationshipsinsideout@gmail.com. Thank you so much.
Thank you.
Thank you guys. Thank you guys so much.